To help prevent infection and help your child heal more quickly, cap changes are completed once a week or when blood is drawn. Before leaving the hospital, your child's central line care nurse will instruct you on how to change your child's catheter cap. Before changing your child's catheter cap, be sure to wipe down all work areas with disinfectant wipes. Supplies needed to change a catheter cap include a catheter cap, 1 cap for each lumen, alcohol pads, 2 alcohol pads will be needed for each lumen, sterile gloves, a mask, and a pre-filled normal saline syringe for each lumen. You will also need additional masks and, if prescribed, a pre-filled heparin syringe for each lumen. When changing the cap on your child's catheter, you will be instructed to clamp the catheter. Clamping the catheter is vital in order to keep air out of the venous system when the cap is off. Air in the venous system is called an air embolism and can be dangerous. Keep the catheter clamped when it's not in use. To change the cap on your child's catheter, begin by washing your hands thoroughly with soap and water or scrubbing your hands vigorously with a hand sanitizer. Rub your hands together for 15 seconds each cleaning period, whether you use soap or hand sanitizer. Put on the mask. Everyone in the room, including the child, must wear a mask during the cap change. Before setting up the sterile field, you must clamp the catheter. Clamp over the reinforced clamping sleeve on the tunneled catheter. This is the thickest part of the catheter. Remove the wrapped sterile gloves from the package and place it on your work area. Open the gloves carefully to make sure they remain sterile. Look over to ensure that there is no damage to the gloves. Only the outer borders of the package, which is 1 inch around, can be touched by your non-gloved fingers. The wrapper from the sterile gloves will be your sterile field for the cap change. Open all your supplies and drop them inside the glove package. With the hand you usually write with, grasp the opposite glove at the folded edge of the cuff. Pick the glove up by the folded edge. Slip your hand into the glove. Keep your hand flat and your thumb tucked in. Pull the glove on. Be careful not to touch the outside of the glove. Touch only the part of the glove that will be next to your skin. Leave the cuff of the glove folded. With your gloved hand, slip your fingers into the folded cuff of the other glove. Pick up the second glove. Slip the glove over your fingers. Keep the hand that you are putting the glove on flat. Keep the glove thumb up and back to keep from touching your bare palm or wrist. Pull the glove over your hand. Adjust each glove to get a snug fit. Reach under the cuffed part to pull up or adjust. Once you have your gloves on, keep your hands in front of you and above your waist. Do not touch anything outside of the sterile field. Remove the white cap from the syringe. Do not touch the tip of the syringe. Screw the syringe into the new catheter cap. Be careful not to touch the white center of the catheter cap or the top of the syringe. Remove the blue cap from the catheter cap. Do not touch the tip of the catheter cap. With the syringe pointing up, push the plunger up to push out the air bubble. Put the blue cap back on the catheter cap and lay the syringe on the sterile field. Scrub the area where the cap meets the catheter with an alcohol wipe for 15 seconds and allow it to dry for 15 seconds. Try to keep one hand clean. The clean hand will touch the non-sterile parts of the line while cleaning, and one hand sterile in the process. Unscrew the old cap and throw it away. Be careful not to touch the end of the central line with your gloves. Place the second alcohol wipe you have not touched over the entrance to the catheter. Scrub the catheter hub with the alcohol wipe in a windshield wiper motion. Scrub for 15 seconds and allow it to dry for 15 seconds. Pick up the syringe with the new cap on it. Remove the blue cap and screw into the hub. Do not screw the syringe in too tight. Unclamp the catheter and begin flushing the central line slowly and steadily. When flushing is complete, clamp the central line and remove the syringe from the new cap. Your child's doctor will prescribe medication and, if needed, heparin. If you have to give your child heparin, you will follow the same steps as you would for flushing your child's catheter. Some important tips to remember. The end of your catheter should always have a cap on it. This cap must be scrubbed for 15 seconds and allowed to dry for 15 seconds before injecting anything into the cap. Do not rush the dry time. If the alcohol is not completely dry, it will create cement for the cap and it will be very difficult to get off. Caps are changed once a week or when blood is drawn. Cap changes are a sterile technique. If a cap change kit is available, your child's central line care nurse will go over instructions for changing your child's catheter cap. If you have questions about the cap change, please contact your child's central line care nurse. Thank you again for choosing Cleveland Clinic for your care.